Welcome to this second part of the consultation structure. I'm Dr. Catherine Miles. If you haven't already watched part one, please stop this recording and go and watch part one first. So this is part two. So as we looked at in part one, we saw that we need to have a good structure for the consultation, just like a building needs to have good foundations and a good structure. And as we talk with our patients, we want to be following a really good structure of for our consultations so that they're effective and efficient. And we looked at the general structure that is often used, which is introductions to begin with, and we can include the patient perspective at that point, or actually patient profile, sorry, at that point, or leave it actually to be included in the social history. And then we can look at the presenting complaints, the history of presenting complaints, the patient's perspective about their problems. We can find out about their illnesses in the past, so their past medical and surgical history. We can find about the health in the family history. We can then discover about drug history and allergies, so what medicines they take, any allergies they have, and their general social history, their lifestyle. And last time we looked at this first few, so we looked at the golden minutes, if you remember those beginning introductions that need to be so well done, of introducing yourself, checking you've got the right patient, making them comfortable, developing rapport, starting with a really good opening question, and then actively listening and waiting and not interrupting that patient to find out as many symptoms as you can at the very start, that beginning introductions. We can also, if you recall, find out the patient's profile, but that is a much more closed question style and may not build the relationship with the patient. As we ask our opening questions, we find out all those symptoms. We can use some skills to really help us at this point, and then we want to find out the history of the presenting complaint. So that's looking at the timeline, the sequence of events, the story of their disease. And then we move on to the patient's perspective. So the patient's perspective is a really good thing to do at this point, because it basically means, how is this patient feeling about their symptoms and what is happening to them? And of course, different patients will have different ideas and concerns about their disease. So for example, an elderly gentleman who comes to you with central chest pain may actually think, oh, this is a heart attack. Or he may think, oh, I've got bad indigestion. Now, for somebody maybe who's a younger patient who searches on the internet and finds out lots of information, they may have chest pain and may think, oh, it's a heart attack. Now, it's a lot less likely that this patient may be having a heart attack. They might more likely be having indigestion, but they may have certain ideas or concerns or worries that affects them in a different way to another patient, especially if, for example, they have a close family member, or if there's somebody of their friends who has had similar symptoms and it's been very serious. So different patients can come with different views about their symptoms, depending on who they are. So maybe if they're older, if they're younger, if they're more educated, less educated, if they live in a rural area, in the city, different factors will affect how they are experiencing the same symptoms and what they think about it. So the patient's perspective is composed of their ideas, their concerns, and their expectations. So we sometimes call this ICE, like Doge. So we want to find out, what are they thinking about, what are they worried about, what they expect the doctor to do. And you will learn a lot more about this as I discuss it in the lecture on communication skills. And some of the skills that you actually need to pick up the patient's perspective is active listening and picking up these verbal and non-verbal cues. So that's noticing little cues or clues about how the patient seems to be feeling or what they might be thinking. So after we've done the patient's perspective, we can now move on to the rest of the structure, which becomes to be much more focused and closed questions. So we want to ask about the past medical and surgical history. Again, this terminology is something that we use as doctors. So do not say to your patient, "What is your past medical history?" Okay, you need to use a different question. So for example, you want to say, "Do you have any medical problems? Have you had any operations? Have you attended hospital clinics before with the same problem or with other problems?" And then you can move on to some more closed questions about, specifically, when were you in hospital? What were you told? What happened? What operation did you have? So the past medical and surgical history includes both diseases in the past and operations in the past. Then we move on to family history. We want to know if there are any diseases within the family that could be affecting our patient. And as you can see, this is a family tree, and we can actually draw out family trees to find if there's genetic diseases through the family. However, it may not be a specific genetic disease, but a slight predisposition to getting certain diseases. So again, asking an open question to begin with, such as, are there any diseases that run in your family? Are your parents alive? Do they have any chronic illnesses? These are questions that you can ask about. You do want to think about if it is a specific genetic disorder, even writing out a family tree like the one you can see here. And ideally, you want to have 3 generations worth of data. You want to find out if there's been any marriages, for example, of first cousins, if there's been any spontaneous abortions or miscarriages. And it can be important to draw out, obviously, males are squares, females are circles, affected in one colour, or you can use a line through for deceased. And you want to draw out with the youngest on the right and the oldest on the left. So asking the family history is important to find out any genetic predispositions or any things like heart problems, hypertension, high blood pressure, diabetes or cancer that seemingly runs in the family. Then we want to move on to drug history and allergies. So within this, we want to be asking questions about if patients take any prescribed medications. And then if they do, you need to find out those details. So what is the name of the medicine? And you want the actual generic name, not just the brand name. You want to find out how much they take. Do they take 5 milligrams, 10 milligrams, 20 milligrams? Sometimes it can be hard because patients can say, I take 1 tablet, and they don't know what that 1 tablet measurement is. You want to find out how often they take the medicine. Is it twice a day, once a day? And why do they take them? And it is also important to ask about not prescribed medicines, so over-the-counter medicines, medicines they have just gone without a prescription and bought, or maybe herbal medicines that they're taking, because they can sometimes interact with a drug that maybe I want to prescribe to my patient. And please do not forget to ask about allergies. And this is not just allergies to medicines, but allergies in general. If our patient is staying in hospital and has a food allergy, we want to know that we don't give them a food that will make them have a severe allergic reaction. And with allergies, you want to know what happens when they do have an allergic reaction. Is it just that they become a bit itchy and red? Is it that they actually start to swell up and they can't breathe? So these are the things we want to know about drug history and allergies. Then finally, we want to move on to social history. And this is really finding out more about the lifestyle of the patient that could be affecting their health and could be part of the reason for the disease that they seemingly have or the symptoms that they've come to you with. And so we want to find out, and this can be anything from a general lifestyle factors to very in-depth what happened to them during childhood, their experiences, their relationships, and in their household. But the general things we usually ask about are about their lifestyle, about their occupation, if we haven't asked it in the patient profile already. We want to know about smoking and alcohol and travel. And so for smoking, we need to ask our patients, do you smoke? Now they might say no. If they say no, the next question is, have you ever smoked? And they might say yes. The next question after that is, when did you give up? Because they might say yesterday. So we want to know, does this person smoke now? Have they ever smoked in the past, and when did they give up? How long did they smoke for? And if they are still currently smoking, how much do they smoke? How many cigarettes a day? And for how many years have they smoked? In terms of alcohol, again, in this culture, it can be a bit more sensitive to ask about alcohol. But we do want to know, because there are certain diseases that are related to drinking alcohol. So maybe asking, I'm sorry to ask this question, but it's something we ask all our patients, do you drink any alcohol? And if the patient says yes, again, you want to know, how much do you drink in a week? Are there any signs of addiction? Are you worried about this patient having a problem with alcohol? You may need to ask some other questions, such as, do you need to have a drink in the morning? Do you feel you can't go a day without drinking alcohol? These sorts of things. And then for travel, why is that important? Well, there are certain diseases that are related to certain locations. So for example, malaria, we can catch malaria from the mosquito, transmission by mosquitoes in certain countries. So we want to know, have you travelled anywhere recently? And maybe what accommodation the patient has stayed in. For example, there's other things such as traveller's diarrhea that patients can get. So we want to know, have they been drinking clean water or not? So these are just some other factors that pull together to really help us to get the story of the patient's symptoms, how they're experiencing them, how their health has been in the past, other factors to really help us try to diagnose what is going on with this patient at this point. So the structure that we would really want you to be using during your consultation sessions is that you introduce yourself, check you've got the right patient, you find out their presenting complaints, the problems that they've come with, you find out the story of those problems, the history of the presenting complaints, you find out their perspective of these problems, how is it affecting their life. Then you want to find out about their health in the past, their past medical and surgical history. You want to find out about the general health within the family, so the family history. You want to find out about their drug history and allergies. So do they take any medicines? Do they have any allergic problems, allergic reactions to anything? And finally, their social history. The things like their occupation, who is with them at home, are they married, do they have children, do they smoke, do they drink alcohol, have they travelled anywhere recently? And this makes up the consultation for the gathering information. Then you would move on to physical examination and examine the patient. So I hope that I have shown you that it's important to have a really good structure for the consultation, just as you would have a good structure for a building. Thank you very much.